So, welcome everyone to BPOU's monthly community education webinar. Occasionally, we do these in person. Thanks for joining us tonight. This is also, as people have come to learn, this is an opportunity where we also help our future physicians, such as Chimdi Adiwa here, to one, learn how to continue to be advocates within the community, not only just the Black community, but as patient advocates as well, but also to make sure that you are equipped with the best information to make decisions for you, yourself, and your family. So thanks for joining us this evening. All right, a couple housekeeping rules. We will have quizzes if people are familiar with our format during our webinar. Please put your answer to the quiz in the chat. It's usually going to be multiple choice, or true false. Whoever gets it right first, myself or Armand will ask you to put your email into the chat so we can make sure it's recorded, so you can get your digital Amazon gift card. You also, during those breaks, is also the time when we'll take questions. Additionally, please place questions within the chat. This also will be recorded. So while it's recorded, you will have the opportunity to, one, see this on our YouTube channel, but also it will be on our website under community webinar presentations. Our next month, actually, as I give a quick plug, will be on diabetes awareness and prevention as we go into November, because November is Diabetes Awareness Month. So, but now as we close out heading into Halloween, we are going to learn about a little bit more details on breast cancer prevention and how various types of breast cancer and how it can affect you and your family members. So, and what can we best do as a community to protect one another? And I will now hand it over to, Chimdi, if you want to go to the next slide. Or were we on the presentation slide?
Okay.
Here we go.
Yeah.
So these are our presenters. So people that may not know me as I started off without introducing myself, I'm Dr. Richard Ferguson, president and founder of Black Physicians of Utah. And we are joined with our primary presenter. This is Chimdi Ihediwa. Did I say your last name right?
Yeah, close enough, but it's okay.
Please correct me. So she is one of our extraordinary BPOU mentees. Additionally, she is a biomedical engineering graduate from University of Utah. She is about to have several publications since being with us from 2 years ago as a clinical research scholar under BPOU. She is with the Lions Eye Center, and she is currently prepping for her MCAT. She's literally in about an hour and 20 minutes after this, she's going into her MCAT prep. So I think that just shows how serious that we take this presentation and what it means to her as a future physician that's going to be a community leader and advocate for public health. So without further ado, Chimdi, you can take control.
Thank you so much. And thank you to everyone for being here. So before I start, I just wanted to emphasize that knowledge can lead to early detection and early detection can save lives. And I feel like that's going to be a common theme you will see during the entire presentation. But yeah, so the primary objectives we're going to be talking about is basically understanding the risks of breast cancer and modern screening guidelines. We're also going to learn how treatment is evolving and identify why Black women specifically have higher death rates despite having similar rates. And then we're going to leave with action steps and Utah-specific resources. And I know some people may be joining outside of Utah, and I do apologize, but the resources or things I have had experience with. Okay, so I want you guys to meet my auntie. This is Auntie Geb. She is the most amazing person in the world, and she was diagnosed with stage 4 ovarian cancer. I know that it's not breast cancer, but I basically want to like dedicate this slide to her. We lost her this summer due to cancer. So yeah, cancer does not discriminate who it affects, but inequality determines who survives. Okay, breast cancer is the number one leading cause number one cancer amongst women. 1 in 8 women will experience cancer in their breast cancer in their lifetime. And I can think of 4 people on the top of my head who I know have had breast cancer. There's going to be 300,000 new cases per year and 42,000 deaths per year. And a lot of this is just due to lack of awareness or late detection. Okay, pop quiz. We're gonna start with the quiz. Um, Black women are more likely to get breast cancer than white women. True or false? Put the A or B in the chat.
Seems like everybody took it. They took the bait. Oh, Michael, you can't go and do that now.
Okay, I'm gonna give you all like 5 more seconds.
Well,
And
I
feel
think
free, like,
you're done because everyone's just
yeah,
going to
take your
start.
time.
But it seems like it was Ella Gold that got it correct. So Ella, if you could put your email here in the chat, please tell them more, Jimmy.
Okay, so the answer is actually false. So the incidence is similar regardless of race. Breast cancer is pretty much random, and there is no like race specific um like inequalities in terms of getting cancer. But that doesn't mean but Black women are still dying more from breast cancer. So even though the prevalence is the same in the state of Utah, Black women are being diagnosed less. And again, Black women, even though they're being diagnosed less, they're more likely to die from breast cancer, with mortality rates of 22% compared to 19 overall. Okay, who is at risk for breast cancer? And we're gonna quickly just go over some of sorry, I'm the chat. Okay, we're just gonna quickly go over some of the risks that are associated with breast cancer. So we're going to start with family history. So due to advances in medical research, researchers have identified a gene mutation that has a strong correlation with breast cancer, which is the BRCA1 and 2 gene. And people who have this gene are 55 to 72% of developing breast cancer in their lifetime. And also, if a family member has had breast or uterine cancer, they're also at higher risk. So think about your mother, your sister, or your daughter. Yes, your daughter. So if any of those members have had breast cancer, you're more of a higher risk to breast cancer. And I just wanted to elaborate more why uterine cancer. So breast cancer is technically linked with uterine cancer. And this graph on the right here just shows some of the correlations, positive and negative correlations with different reproductive health cancers. And genetic testing can be used to detect the BRCA genes. So again, and also a problem is breast density. 40% of all women have super dense breasts. And this image on the right, you can see there's cancer in the fatty tissue side, but it's harder to see on the dense tissue side. So therefore, it's actually harder for women with dense tissue breasts to be diagnosed with breast cancer. Next, we'll be talking about radiation. There's basically radiation everywhere. Flying, machines, phone, environmental, even nuclear radiation. And of course, radiation is bad, but there is no way of getting rid of getting rid of radiation because it's just everywhere. But there are basically 2 types of radiations that could potentially cause cancer. So the low dose radiations are from like medical imaging equipment, but but for patients specifically, they're not exposed that much. So they are technically at lower risks if you have had medical imaging. But people who work in healthcare, like doctors and nurses who are constantly exposed, are at higher risks, even though it's a low dosage. And then the high dosage is basically large amounts of radiation that has been exposed to before the age of 30. So people who have had chest radiation therapy are at significant risk of developing breast cancer. So basically, I'm just quickly going to explain how radiation will cause cancer. So radiation would basically damage the DNA in your cells, and then that DNA damage is called a mutation. So the mutation, so that means that cell is not going to be like normal, which is a cancerous cell. And then due to uncontrollable growth, it would therefore then cause a tumor. So yeah, so our body already has mechanisms for detecting this DNA damage. But again, if those mechanisms fail, then the cancer would progress. Okay, age is also a factor. So about 90% of all breast cancer cases are of women over the age of 45. This is why we have guidelines for screening to start at 40. Shown on this graph, it's basically there's literally like a exponential growth or exponential like correlation. And aging does not cause cancer. It's because, again, talking about the bodily mechanisms and also with menopause and hormonal changes, this also will stimulate the cancer cells. And again, with age, the body repair and immune system also weakens. So therefore, our natural mechanisms are not able to detect these mutations.
All right, and I will speak to this a little bit because, and sorry, this slide may seem a little sparse, but thank you, Chimney, for getting us this far. And I'm, by a raise of hands, because breast cancer has affected so many, and I really want to just kind of drive down the point of how 1 in 8. So who here knows someone or has had someone in their family impacted by breast cancer? You can just either put a thumbs up in the chat, or I have, or I know someone, or say yes. And I bet it will be fairly high. It will probably be half the people on this call. If anything, it should be possibly 1 in 8 of everyone in this call probably knows someone. So I particularly saw my great aunt suffer with breast cancer, and it reoccurred multiple times. This is when she was first diagnosed in the late 80s. And then it reoccurred about twice. And the third time after chemo treatments, the third time it reoccurred in her spine and in her brain. And it was stage 4 at that point. And we'll go into stages here in a little bit, where it was too difficult to treat. And also complicating that factor was also her age. What I want to go into is some things that we can do, since we know much of it seems to be random and who actually will succumb to breast cancer. But there are some things that we can do to minimize our risks. And these have been showing a small linkage of causation to increased risk of developing. One thing that we may have noticed in anyone that's attended any of our BPOU cancer awareness lectures, I think if anyone attended Marwa's lecture, who is currently a third year at University of Utah School of Medicine, and she discussed inflammation. And this is a little bit that Chimdi went over a bit earlier here on how things or what occurs to our cells when they're trying to replicate. And when we have more that is causing more increased inflammation with our body, either from diet or increased adipose tissue or certain hormones that increase inflammation in our bodies, that eventually more of those inflammatory chemical mediators in our body will cause our cells to more likely to make an error when replicating. And so if you have denser fatty tissue, which is more common in Black women in regards to breast tissue, but also if you have more adipose tissue throughout your body, you're having increased release of estrogen and increased release of, then with estrogen, which is pro-inflammatory, you'll get more inflammatory mediator chemicals going on throughout your body, slightly increasing one's risk. So one thing that we do know that increases risk is alcohol. All right, alcohol not only does it cause liver damage, but whenever we damage parts of our body goes through a repair activity when you have cellular damage, and so that occurs with alcohol use. Therefore, you get increased inflammation within the body. So you're going to have increased cellular repair with alcohol use. Excessive weight. Demographically in the US, almost 50%, according to our current BMI standard, of African American women, or those that identify as Black, will qualify as obese, often a BMI of 30 or greater. This increases that risk of adipose tissue that one has. That once again, if not reduced, you have increased, I would say, drive or release of the chemical mediators that will cause the inflammatory change and errors during cellular replication. But we have to then look at the risk factors that continue to aid. So if you have excessive weight and one is not exercising very much, adipose tissue increases. Thus, there's a correlation between excessive weight and physical inactivity. But then, of course, hormone therapy. Remember, estrogen, increased amounts of estrogen being secreted by adipose tissue, not helpful, increases more cellular change. When we have women that are just postmenopausal and they're trying to address symptoms related or secondary to menopause, they will all sometimes to ablate some of those symptoms will take for a short period of time, hopefully not for a long period of time. Often in those first 1 to 5 years of menopause, they will doctor may place them on hormone replacement therapy. So this is where you discuss that risk with your particular provider, because if you're someone, pregnancy is protective. Okay, so if you are a null parus, a woman that's say 51, and you're obese and you're not very active, say due to an injury, and you're now menopausal, starting on estrogen therapy now is increasing your risk even more for breast cancer. And then of course, smoking. Not only does it cause cellular damage, but it also releases a whole significant amount of carcinogens within our body. So we have to understand that carcinogens also cause cellular DNA damage in the DNA, and errors made during cellular replication with all our cells, but more likely where you have a denser amount of cells and fatty tissue. So that's the biggest thing that I want people to kind of take away from this. And just, the thing is, this slide isn't all doom and gloom. We really want people to understand, how do you lower the risk? And so the one I want people to take away from this is limit alcohol. We're not saying you got to go zero, but if you drink less than one a day, move more. American Heart Association didn't make up those numbers or a number of minutes per week for they made it up for a reason, or it was not so made up. It was developed and studied through research, and it's very meaningful, meaning 150 minutes per week, moderate to sometimes 75 minutes per week of vigorous exercise reduces one risk. So the key is sit less. This is also why people may have participated, if some folks on this call were brothers and sisters that run. This is a heart health initiative that not only addresses heart health, but also decreases what? Cancer risk. So also maintain a healthy weight after menopause. Okay, so eating fiber daily, trying to reduce weight gain. And the other thing I would say is consider non-hormonal options when it comes to menopausal hormone therapy. And once again, it's already a nasty kind of habit. Stop smoking is probably one of the biggest things that one can do. Stop smoking and losing weight are probably the two biggest risk factors that will have the most impact in reducing one's risk. So that is part of my segment there. And please, if any questions, feel free to put them in the chat. We are coming up to another point where we can take on some questions. Please continue, Chimdi.
Awesome. Thank you so much. Okay, pop quiz again. Which behavior can lower your breast cancer risks?
Kind of gave it away, huh?
Yeah.
Did someone put false?
Okay, 5 more seconds.
I like your options here. Detox teas.
Okay, so you guys were right. The answer is A. There is an entire field dedicated to exercise oncology because exercise is considered a medical intervention. I actually did research at the Huntsman Cancer Institute over 2 years ago in a kinesiology lab, and we were kind of like seeing the correlation with exercise and basically how chemotherapy was, to see if there was a way exercise could reduce the effects of chemotherapy. And there was a really strong correlation, and I was really happy to be part of that project and again continuing that. So yeah, exercise is super important. Okay. Oh,
Very
do we
good.
have any questions? There's
Yes,
questions
any
in the chat.
questions? I saw there was one in the chat, and it's by Charlotte. It says, "Can one develop cancer quitting smoking for 5 years?" It seems like you got one of your relatives here. Do you want to answer that, Chimney?
I don't think so.
So, the great question, and it's got a couple factors with it. So, when we think about lung cancer risk and going back to one's baseline as if you had not smoked before, you often need about 15 years of being abstaining from smoking. But it also depends how long you've been smoking. But if someone had stopped smoking and they were smoking, say, even for 2 years, it takes more than 5 years to get back to your baseline of what your lung health would be and its risk factors where you're kind of on par. So if you smoked briefly at when you were 25 for 1 year, it'll be almost 40. We can also say slightly under 40 before you were to return to normal baseline risk. Very good. Yes, there will be another question or two. You'll get a chance, Charlotte. You just gotta be quick on it. So, any other questions before we move on? And feel free to come off mute if it's easier to verbally ask a question. Okay. All right. Moving on. So here we have types of breast cancer. And this is where we're going to get into more of the hard science around the research that's been done for breast cancers. But what one often needs to understand is where it is occurring. All right. So when we look at breast tissue, we have the lobe, and then we have the milk ducts, and then we have the fatty tissue. So one can have lobular forms of cancer. It can occur at any area. It can even occur in the skin, but most likely it's within the ducts, the lobes, or the fatty tissue. That's why if you have less amount of fatty tissue in your breasts, it's lower likelihood that, not I wouldn't say necessarily lower likelihood, but it reduces one risk of developing cancer. Because if you have less cellular matter for errors to occur, due to having smaller or less fatty adipose tissue in your breasts, then it actually will, in a sense, lower one's risk for development. Still 1 in 8 risk, 1 in 8, but to be likely one of those 1 in 8 to possibly develop cancer. So there's particular receptors that are lead to excuse me. There are particular estrogen receptors. Excuse me. So, in regards to types of breast cancers, there's estrogen receptors. All right. So, we have to understand that estrogen receptor positive versus negative. All right. And that is why it is very important on when one wants to have that shared decision making in a postmenopausal period on if you want to take estrogen or not to equate symptoms, because you actually could be amplifying or encouraging the growth of undiagnosed breast cancer if you are not getting regularly screened. And then we have progesterone receptor positive, if one can have that type of breast cancer as well. And then we have HER2 growth factor. So that's if someone is lacking that particular growth factor. And to the right of it, I'm going to continue to go down. So we either have HER positive, all right, or HER2 negative, or we have HER2 positive, and then we have triple negative breast cancer. They also have inflammatory breast cancer as well. That can be very aggressive. That's actually where a woman may notice acute swelling or asymmetry in one's breasts in a rather rapid time frame, meaning within a matter of weeks, you can see change, as opposed to noticing a lump that has slowly changed, gotten harder, or changing consistency, say over months versus a matter of weeks or days. So inflammatory breast cancer, of course, being more common when diagnosed in those that are Black, Latino, and Native American. But when it comes to common treatments, we of course have hormone therapies, and then we have a special type of inhibitors, We won't go into too much of pharmacology lecture here, but happy to answer questions on it. And then, but the key here to take away is HER2 positive, all right, a very fairly common. The one often is can be aggressive, but it is highly treatable. Once again, early detection is what's important. And then when you have a triple negative breast cancer, you often need chemotherapy combined with immunotherapy. And there is an option as well for several of these cancers, depending on how far along the cancer has progressed, where radiation therapy can also be part of treatment. But I think the biggest thing that we want people to take away is it does not have to be a death sentence when one is diagnosed. It can be very anxiety provoking, but there are many women, and even as someone with, given my day job, who approves chemotherapy and cancer treatments for women living and being treated with breast cancer. If you were treated, there's a way that the drugs are so advanced now, and the chemotherapy therapeutic agents can actually keep it in check, where women are living for years with stage 4 breast cancer. But the key is you want to try to eradicate it. And then you go through screening to make sure that you're missing any evidence of any recurrence. But these are the most common types that one would most likely be diagnosed for and screening for based on if it's occurring in the lobe, the ducts, or in the fatty tissue itself. But I think the biggest thing that we want to take away from this is why Black women must be vigilant. Increase adipose tissue in breast tissue, more likely to be diagnosed with the most aggressive form, and often at a younger age, and less likely to be offered genetic testing. But the most important thing here to understand is genetic testing isn't necessarily going to screen you out and give you increased wherewithal that you have it, and unless it's specific to BRCA1 and BRCA2, which is a very specific genetic test to see if you or someone in your primary family relation, meaning a mother, sister, or a daughter, has evidence of that risk factor from genetic tests. So if one has BRCA1 and 2, which can be progressive rapidly and lead to other cancers, that's one where genetic testing is beneficial in knowing one's family history. But I'm sorry, did I miss a question in the chat? All right. Okay. Chimney, there's a question. And so Charlotte asks, can one survive stage 4 breast cancer? So, and what if it has? So, can one continue to live and have a bit of a normal life with stage 4? Yes, one can. I actually know I actually went on ABC 4 years ago with a stage 4 cancer survivor. She was a lawyer, graduated of the J.C. Quinney law school, active lawyer, and she went back to work and she continued to receive treatments. But she says, I was so happy that I was insured and I was able to afford the treatments. And so the answer is yes. What if it has metastasized to other organs? There's some variability there. So I would say it depends on the cancer type. Just saying the stage is not enough. But I can put it this way. There are several women that have survived 5 years or more with metastatic stage 4. But that I can't give you sort of like a easy mortality rate right now, because I kind of would need to know more of the specific form of breast cancer and treatments received. But can someone live more than 5 years with metastatic breast cancer? Yes, definitely possible. All right.
Awesome.
Hope that answered the question. I didn't want to get jargon, get people filled with a ton of medical jargon as I start to try, because often stage 4 implies metastatic, that it's spread to beyond one's lymph nodes and other parts of the body. Anyhow, please continue, Chimney.
Awesome. Thank you guys so much for the question. So again, we're wanting to elaborate on the importance of early detection. There is basically a 99% survival rate if you have stage 1 breast cancer. So breast cancer is not a death sentence. So early detection equals early treatment equals more chances of surviving. So these are the guidelines, the national guidelines for screening for all ages for 25 down to, I get 50 and above. And then, but screening for mammograms actually start at the age of 40 because again, due to the risks that they are, so patients over 40 are at higher risk. So that's why screening starts at 40. Okay, so how to perform a breast self-examination. I'm not going to go too much in details. This infographic will be provided afterwards in our resources if you want to like look more into it. You can probably also find videos on YouTube to learn how to perform this self-examination. So basically, overall, we want to stand in front of a mirror so we can actually visualize and kind of like have our arms up because cancer can also kind of like go towards our armpit region because
Hey,
that's where our
Chimney.
lymph nodes are. Kind of like
Chimney.
fill in a circular motion to, again, feel for a mass or anything of some sort, and then do it monthly right after your menstrual cycle because I think that's when your hormones are, or our hormones are like pretty much normal because they fluctuate a lot.
Chimney.
Okay. Ooh,
Can you hear me?
yeah.
Can you go back? All right. So I was going to say, yeah, actually, I can be your mirror. So would you like to direct me through a self breast exam? Because can men get breast cancer?
We're gonna get to that.
But so if I were to just demonstrate, where do I start?
So, sorry, I don't have my camera on. Like, I
Oh,
don't
you
have
can't see me?
no, I turned it off
Well,
because
at
I
least
need,
you can hear me. But
yeah, I
I'll go
can hear
through
you.
it.
So you would start with your arms up
All right.
and then you basically will squeeze each nipple to check for pain or discharge
Mm-hmm.
and
Yep.
basically go in an upward motion
Mm-hmm.
and then go in a circular motion
Yep.
and then try doing it laying down
Mm-hmm.
and repeat those circular motion and
Good.
upward or radiant motion.
And it's very important to start often in the axilla. That's another area where women will sometimes miss. Breast tissue extends up into the armpit, so it's not just what you can see on the front of your chest. So I think that's big to take away, but often circular motion, I often tell everyone in to out. And we as providers and doctors, we often divide. If you notice that when it comes to documentation or looking at a chart, we as physicians will tend to divide the breast into quadrants. So, and if we identify something that's hard or firm, we'll say, medial right quadrant, lateral right quadrant, upper lateral quadrant, or they may demark it with 1, 2, 3, and 4. But depends on what type of documentation sheet they're using in their clinic or exam room at the time. But often in to out, often using two hands, all right? Often the fingertips feeling, extending up into the axilla, and making sure you check your nipples. All right. Hopefully everyone was able to get a little bit out of that. As we said, we were going to provide this examination sheet at the end. All right. Sorry to interrupt, Chimney.
Yeah, no problem. Okay, so let's say you do find a lump in your breasts. What would you do? Number one, do not panic. It's very common to find lumps and bumps in your breasts, and these are basically types of growths that could potentially happen. But tumors are potential. They're like these are all benign, meaning that they're not cancerous, but tumors are cancerous. So the possibility of it actually being breast cancer is it's something. So yeah, do not panic. Okay, pop quiz. If breast cancer lumps are painless, what does that mean?
All right. We'll give it another minute. All right. People seem to be on to it here. Chimney, would you like to give the answer?
Yes. The answer is C. Painless lumps can still be cancer. So most breast cancer lumps are painless, and pain could indicate something more dangerous, meaning that it could be it could have potentially progressed. So pain usually appears only after cancer has grown or spread. So so we don't want any pain. So no pain does not mean no risk, but it could still be cancerous. Okay, so track your changes over time. Note when you first notice the mass and then track it again over one menstrual cycle. Again, with the hormone fluctuations, so they can basically have a baseline guideline. And then also check for lumps, swelling, discharge coming out from the nipples, lumps around the armpits, dimpling looking like orange skin, kind of like seen in this figure right here, rashes, nipple inversion, any signs of pain or any color change. These are all signs you should be looking out for. And then you contact your doctor, your primary care physician or your OBGYN and ask for a breast exam. And there are multiple imaging options that are provided, which are mammograms, ultrasounds, and MRIs. MRIs are more detailed and should be used for high risk or super dense tissue breasts, which mammograms, if you remember the picture from earlier, have a harder time trying to identify cancer in large breast density.
So Chimdi, I was going to answer a question that was here in the chat, and that was by Gianna or Gina. Sorry, or Miss Raphael. Sorry if I mispronounced your first name. Is the self-exam the same for men too? And the answer is yes. Once again, feeling for all where there is area of fatty tissue. Yes, there tends to be a little bit more pectoral density, but there are, of course, a number of obese men that will be at a higher increased risk with similar to those risk factors of being sedentary that I discussed before. But yes, we will get into the incidence of that with men. But yes, the exam would be very similar. All right, sorry, you may continue.
Yeah. And then after you contact with your doctors, basically follow all the information that they provide after the exam, and they will most likely get a biopsy. So meaning that they'll take samples of the tissue or the growth and then take it into the lab. And that's basically how they get their diagnosis that it is breast cancer. Okay, so we kind of like talked about all the sciences and all the risks and factors, but I also kind of like wanted to spend some time talking about the barriers, especially the community faces. So looking at this graph, survivor rate drastically decreases as the stages increase. So there's literally almost 100% survivor rate with stage 1 and then 20% for stage 4. So again, the incidence is the same regardless of racial groups, but again, Black women are less likely to get diagnosed for multiple reasonings. Okay, another pop quiz. We kind of like alluded to this answer. Can men get breast cancer?
Very good. All the right answers. And Aaliyah, you are our winner.
Awesome. So, yes, but it's very rare.
How rare?
1 in 1,000. I actually have a question. Is there like a correlation with like gyno with like breast cancer? Like if you know any?
Got sorry, I don't
So
correlation with
it's like
gyno?
when it's basically like when men have like breast tissue, even though like they're not meant to. I don't know. It's just like I've seen something online about men with like breast tissue cells, and sometimes they tend to like lactate. But that's also due to like hormonal
Yeah,
imbalances.
you can actually get galactorrhea in a man if they have. It's more common if they have a pituitary tumor that produces prolactin. But yes, it's not because they have significant adipose tissue in their chest
Hmm.
necessarily, but that is more common if someone it can be a sign of cancer of someone. So that is concerning to get evaluated in imaging if a man is having discharge from their nipple. But that's more so a hormonal, a primary hormonal, not a primary neuroendocrine hormonal issue that can tend to occur. But yes, as men, if people have obese men in their family, they can tend to no longer have breasts that kind of stay flat in the chest that are built with muscle behind them. They, can become increasingly dense with fatty adipose tissue and can hang similar to how a woman's breast may hang. So, but the difference is men don't produce as much estrogen as women do, or tend to have as much adipose dense fatty tissue as a woman would.
Mhm. Awesome.
All
Do
right.
we have any more questions?
I think we identified our winner, so we can continue. But yes, any questions on that? I think it's something that is overlooked. Men should be performing self-breast exams when, especially if they have pain or discomfort in the soft tissue around their pecs or in their axillary area. Could be more than just a lymph node. Uh, there's a question. No, because we need to be able to know, Charlotte. It would need to be recorded. So we're having everyone just enter into the chat, so it's fair for all.
Okay, I'm gonna move on. So again, alluding more to the barriers of, so what are some of the barriers that can cause, um, that can delay early detection? Okay, so lack of insurance or underinsurance, this tends to delay mammograms and follow-up appointments because these individuals are worried about, cost of care, work schedules, and like no PTO. So screening is not going to be prioritized at that time again because everybody has to work. So again, there is that's another barrier to that could potentially cause later detection for women and men, I guess. Lower referral rates from providers. Black women are actually less likely to be recommended genetic testing or MRI screening because one, they may not even know that it could be an option. And two, even if they are, some people don't like to go for some people tend to not go for doctor appointments because they think it's unnecessary, leading to, oh, and then transportation and childcare can also, again, lead to missed appointments. And again, medical mistrust, especially with what's going on in our current administration. There is a lot of uncertainty with medical advice, and therefore that can delay seeking care. So if anybody, so this is a message to all the men, I guess, and other women or people that you have, or people who that have breast cancer or potentially breast cancer. Um, if they need a ride, literally just help them because again, you're again breaking this barrier for early detection. And again, early detection can lead to early diagnostics and then a higher survival rate. So, and I think a lot of people tend to not think about this because they think it's, silly or yeah, just take an Uber, but yeah, health disparities tend to exist.
And I
Okay.
think go back to that slide, and I just want to echo and re-emphasize your statement there. Transportation. So look at some of these barriers here that lead to health inequities, particularly for Black and marginalized women, that not necessarily are going to have developed breast cancer sooner than anyone else, but they're less likely to get early detection and treatment, which is what we've kind of been driving home here. But helping someone to be able to get access to care, being able to provide childcare so that a mom, a sister, an aunt can be able to receive imaging. The other thing is, it could be something as they could not have any of these barriers, but they're just not realizing how important it is. So, any men that are on this call, many of you have moms, many of you have daughters, and many of you have wives, sisters, aunties, and if they are over 40, And then just asking, it's not necessarily an invasion of privacy, just saying, hey, have you done this year? Are you considering it? How can I help? Because it doesn't always need to fall on women to address breast cancer screening, especially if you have a family member that is in that risk category. All right, sorry. Please continue, Chimney.
Awesome. So I was able to put together a list of resources for places to access screenings in Utah. So feel free to take a picture, feel free to take a screenshot. Um, but yeah, so the Huntsman Cancer Institute actually offers a screening voucher program. So they offer financial assistance for breast cancer screening, and that's their phone number and their website right there. Um, Next is the mobile mammograms. So kind of like the Boo Bus. I actually hope this video plays, but I was volunteering and then I saw a bunch of Boo Buses. Yeah, I thought it was really fun, but it kind of like again addresses that transportation barrier. So bringing the mammograms to the community themselves. Intermountain and University of Utah Health offer them, and you can call those numbers and basically ask when the next Boo Bus is going to be next, closer to your location. Um, the next will be Planned Parenthood. They provide screening regardless of insurance or immigration status. And then the Utah Breast and Cervical Cancer Screening Program offers free or low-cost services for eligible women. This, again, I think the criteria is leaning towards lower income, again, a way to address those disparities discussed earlier. And then I have more. Oh,
Very
let me
good. Very good.
Okay, Care Fair. So the place I volunteered at Care Fair this year, and it's hosted by the Junior League of Salt Lake City. And it's an annual free community clinic offering breast exams, mammograms, referrals, and other medical services without ID, no insurance required. They also offer a bunch of other things as well, like diabetes, like A1C, cholesterol, and even I think they also offer like pap smears. So it happens over the summer. It happened over the summer, so it happens every summer. So just be on the lookout for that. I think it's like a really good resource, and a lot of people do not know about this because, again, access to healthcare is very important, and this is a free, community-driven event to kind of like provide that care for the community. And a lot of the people are not going to get paid, so it's all clinicians who volunteer their time to again serve the community. And then the last resource I found was the Susan G. Komen Patient Helpline. And again, they just offer more financial assistance and support for those for screening and testing. So yeah, feel free to take a screenshot. Let me know if you guys want me to go back to some of the slides. And I also apologize for those who are not in Utah. I kind of like just put together a lot of resources that I myself have used or know about.
Chimney, you provided great information that applies to not only Black women, but all women, right? All those with breasts. And also, there are similar resources that are supported by Once County in many states while they're still funded and still there. But definitely, if you want to go back one slide, the
Yeah.
Huntsman Cancer Institute vouchers, giving them a call, going to that website. Mind you, we will have this presentation as well as links. I believe some of these links are already in our breast cancer resources. I'll share that in a side. But go into that website, which Chimney can drop into the chat so people can click on it now, often the easiest way. And just remember, you have to prove income to qualify for the state program that is Utah Breast and Cervical Cancer Screening. So once again, you got to share a little bit of information to make sure that one is eligible. But you don't have to worry about that as much with the Huntsman Cancer Institute screening. All right, very good, Chimney.
And I'm yeah. So together we can defeat breast cancer. Again, knowledge equals early detection. Early detection equals saving lives. So yeah, thank you guys so much for listening and questions.
Awesome, awesome. We have here. Thank you, everyone, for attending. Charlotte, I don't know if that came through. I meant to send that. No, there are no more quizzes. We usually do 3 to 4. I don't know if you attended some of our webinars before. And And no, we do, but that is a good thought. We could consider a general gift card raffle, but we usually want to make it based on those that have listened or given their attention to the presentation. But that is something that we can consider doing in the future. What I do want to make sure everyone understands, let me bring up our, I believe on our reproductive health tab, we have should be updated here. Just going to share. Yeah, so right now on our we have to add more links and we definitely can, but if one goes to our website that we have, see if I can share this with you. 1 second, everyone. And what I want to make sure that everyone can see is it goes to, so if one goes to our resources tab, we'll be adding more to this, our resources tab, reproductive health. And then if one goes to breast cancer, it brings up this site, which will bring to breast cancer, cervical cancer, some of the partners. But we plan on bolstering that up, adding a few more sites or links to our resource page. Okay, I think there was a question I saw there. Um, let me go back. Ella had a question. When are we receiving the gift cards? You probably can get them by tomorrow morning or afternoon. My intern Armand will be taking care of that, and it's a nominal amount. It's not. I think we are only have our budget because we do these webinars every month, and these are, feel free. Once again, as always, I tell everyone if anyone saw the tickets when registering, please donate to support BPOU. So we are able to do this through donations, and some of these donations we're able to get back to encourage people to attend the webinars and to be motivated. So we hope that helps. But yes, you should receive them by tomorrow afternoon at the latest. All right. So I think there was a question where it was a very good one that I don't hear too often, where it says, why do some cancers develop resistance to targeted therapies or chemotherapy? And so the easiest way I can talk about this that I've read probably from an article 2 years ago is some breast cancers stop responding to treatment because the cancer cells adapt. Like anything, their evolution can occur. So our tumor isn't one thing, it's a mix of many cell types. So medicines kill the easy targets while the harder cells survive and multiply. So those surviving cells can change their mutations. And so the key is the drugs can no longer fit in those locks, which are those mutations. So that is sometimes why you'll see doctors using multiple forms of treatment, radiation, not just one type of chemotherapeutic agent to try and target a cell because they know that they're not going to get all of them with, say, just one particular cycle of treatment. May need to use an oral medication form. That's where we had the CNTF blockers. And then also, you may need to switch on backup growth pathways or use certain, or you have to back out certain medications. So I look at this as the tumor's neighborhood can also shield itself. So when you have poor blood flow, um, a woman has had surgery, so you have scar tissue, and then you have immune suppressing agents, that makes the drugs less effective. And some cells shift into tougher stem cell like states. So finally, we've got things that can change actually to your body physically itself, and as a consequence of the medication, particularly immune suppression and scarring, and not having as much blood flow to the tissue, that can seem as though that particular cancer cell is developing resistance. So I would like to say this is why therapies and the combination of therapies change over time to try to combat some of those hard to reach cancer cells. Did that answer your question, Clovis? Hopefully, yes. Any other questions? I agree, Aaliyah. Knowledge is the true prize. Okay, awesome. Great. We will hopefully be able to let you know in the next week or so when we'll have our November webinar. It may be in person, given that it's the holidays. We also want to make sure that there's decent attendance, so we might push it to early December. As we know, many times, diabetes isn't going away anytime soon. Lung illnesses, respiratory illnesses are not going away anytime soon. In January, we're probably going to do our RSV, flu, COVID. But please subscribe to our YouTube channel. Look at our Instagram, our TikTok. Erman, our team are constantly putting out material to educate you, particularly as we go into the seasonal respiratory season. So if you can, get your flu shot, get your RSV shot if you're of age, and COVID if you're someone that's at risk. I particularly have gotten it recently and doing fine, but I work in the emergency room. And then most of all, ask a friend if someone is due in time to get a mammogram, or have you been screened for breast cancer this year, particularly if you're a woman over 40. All right. Thank you, everyone. And that'll be it for this evening. I will hang around in case there's any other questions.